911 calls out in the middle of nowhere with just your partner, and you're going to have this critical patient for hours in the back of a helicopter that may or may not be very dark. My name is Mike Zinn, and I'm a flight paramedic. So a flight paramedic is basically just a paramedic that is working on either a helicopter or a fixed-wing aircraft. And so flight paramedics have all of the certifications and training that a regular ground paramedic has, and then extra certifications in things like critical care management, advanced procedures such as chest tubes and finger thoracostomies, and then administration of blood products and ventilator management. And so flight paramedics respond to all sorts of different types of calls, from 911 calls, either out in the middle of nowhere in the mountains, think of car crashes on very rural areas, medical calls in really small towns that don't have access to EMS. And then we also have interfacility transports, which are taking a patient from a small hospital to a bigger hospital. For a lot of those small hospitals that just don't have the resources available to take care of those critically ill patients. So a day in the life of a flight paramedic, I usually show up about a half an hour before my shift starts, make myself a cup of coffee, and then we talk with the off-going crew about what their day was like previously. So we'll talk about what calls they went on, what equipment they may have used, and if there's any issues with the equipment or the aircraft or anything we need to be aware of. After I start that, I will check out all of my equipment, so things like blood products, ventilators, medication pumps, and all of our medications that we carry. I will then go out to our aircraft. I work at a helicopter base right now, so I'll go out to our helicopter and I'll do a thorough safety walk around, and just making sure that the helicopter is in good working condition. Everything is where it should be. There's no compartments open or anything that shouldn't be open. And then I kind of get the helicopter ready to run a call, make sure my helmet's in the right spot, make sure if it's nighttime, wearing night vision goggles are in the right compartment. And then what we do is have a briefing with our pilot, talking about weather for the day, where we can go, where we won't be able to go, and any sort of PR events or anything we have to do for that day. That usually takes 1 to 2 hours. After that, I come inside and we do our online or in-person trainings, and that's usually 1 to 2 hours a day. Becoming a flight paramedic, there is a lot of training involved, and there's a lot of ongoing training as well. So we are studying all the time. Hours per shift usually. After that, I will go over charts and documentation from other bases. Usually we try to just make sure that there's no errors in the medication math or things like that, or any procedures, and just make sure everybody's holding that standard that we really should be holding. And so after that is all done, after those few hours, the day is kind of ours to either study some more, work out, or just try to take a safety nap, which is actually a very important part of our field. And so we'll do that either through the afternoon, early evening, and then we're just waiting for calls to come in. So on a typical day, we usually run between, I'd say, 2 to 5 flights, and those flights can take anywhere from between 1 hour up to 5 or 6 hours, depending on how long that flight is. And so there are some days that we come in and we work and do 1 to 2 flights, and that's it for the whole day. And then there's some days that we come in and we don't stop from the time I walk through the door until the time I leave the next morning. And then after that, hopefully I get a good night's rest, and then my shift is over, and then kind of repeat with that that oncoming crew, and we'll talk about how the day went, and that's kind of the life of a flight paramedic. So my work schedule, I work 2 24-hour shifts per week for the company that I work for right now. And so generally that is a 24-hour shift, say on Wednesday and then on Friday. And then the next week, this is a really nice part of where I work, I'll work Sunday and then Tuesday and have an entire week off until I have to come back to work. So 2 24-hour shifts a week and then an entire week off before I have to come back to work. other companies that I've worked for or that I've heard of, they do 4 24-hour shifts bunched together and then 8 days off, if that makes sense. And some even bunch 10 days straight on shift with 20 days off. So it's kind of a diverse field with the schedule. So if you're looking to become a flight paramedic, do your research, call the company, see what kind of shifts they work, because it's kind of depending on what you want with what the schedule can be. So I actually had this moment probably about a month ago. I've always known I wanted to be a flight paramedic, and I've loved every second of it since I started, from the very first call, the very first liftoff in the helicopter that I ever was on. But I had a call about a month ago. I've always kind of felt like, I haven't really made it, right? I don't really belong with some of these people that have been working in this field for 20 to 30 years. And we had a call that was this very critical patient at night in the helicopter, giving all sorts of medications, blood products, airway management, and all that ventilator management that goes with it. And we turned this patient around from somebody that was really circling the drain, not doing very well. And some of the suggestions that I was able to come up with really helped on this patient. And so by the time we dropped the patient off at the receiving hospital, the doctor gave us a really good review and said we did a really good job. And it was just like this sense of accomplishment of, maybe I can do this job. And so it took me quite a while to get there, but that was a really cool moment for me, for my career. I was a really new paramedic, and I think being a paramedic is a really cool job. We get to do a lot of really awesome things, and I was actually working with the founder of IMA, Justin Rainey, on a call a long time ago. We went up into the foothills for this mountain biker that had wrecked way up in kind of the middle of nowhere, and we had taken forever to get to this patient, and they were a critical patient, and we called for a helicopter. And so by the time we had gotten to this patient, it had been quite a long time. We were able to kind of get to them, start our initial care, and then this helicopter just kind of came down out of the sky. The crew that got out of there was so professional, so efficient, so good at what they did, and so it just made everybody feel so calm. And right from that moment, I was like, that is what I want to do. And now I actually work for that company now, so I'm really proud of where I've come from, and that was kind of that moment for me that really sealed the deal that I wanted to be a flight paramedic. So the steps to become a flight paramedic. Being a flight paramedic is not an entry-level job, so the minimum requirement is 5 years at the company I work for, 5 years as a 911 paramedic. And so you have to become an EMT first, then get into paramedic school, go through paramedic school, get hired as a paramedic in preferably a busy 911 system, and then work as a paramedic for 3 to 5 years typically to get into any sort of flight program. But while you're working as a paramedic, it's very important that you're staying up on all of your training, all of your education, and then when you decide to make that move to flight paramedic, there are some certifications that you generally will have to get, things like your neonatal resuscitation, pre-hospital trauma, or advanced trauma life support, and then a critical care certification such as critical care paramedic or CCPC, or your FPC certification. And all of that requires typically things like prep courses that are 40 to 80 hours worth of schooling on top of all of your paramedic schooling. And so the way I did it was I had decided I wanted to make that leap to flight paramedic, and I studied for about a year before I even decided to interview for a flight paramedic position. So I started off in a local 911 agency, worked there for 7 years, and really just grew as a paramedic, took on extra work such as becoming a mentor, a field training officer, teaching here at IMA and at a paramedic program locally, and just taking on all those extra tasks to really make myself a more rounded provider and a more rounded candidate. And so once I decided I wanted to make that move to flight paramedic, I bought all the textbooks, started learning about critical care medicine, and just really studied for a solid year before I even started to think about applying for a flight interview. And then once I did that, I practiced my interview skills a lot because becoming a flight paramedic is extremely competitive. There are not a ton of flight paramedics in the country, and there's not a ton of flight programs, especially in the Pacific Northwest. And so it's a very competitive industry to get into. And so not only do you need to have that experience and that knowledge, you need to be able to portray that knowledge to people that don't know you. And so really important that you not only have that clinical competency, but that you have great communication skills, because that is very important in this industry. So what I would have wished I had known before I started this job was honestly how much I was going to really love the critical care side of medicine. And so, growing up as a field 911 paramedic, we deal with 911 scene calls, very reactive as far as we see something, we do something. Well, the flight paramedic side of things, sure, we have that when we go to scene calls, but the big part of our job is interfacility transports and critical care. And we have to really not only react to what we see, but have this plan in place and critically think of what we want to do for this patient over sometimes the next 2 to 4 hours. And so that was a really intimidating thought, and I didn't think I would like it all that much. It actually kept me from becoming a flight paramedic for probably a year or two. But I've really come to love that part of the job, the ventilator management, the medication infusions that we get to give, and all of this critical care medicine. Things like monitoring patients with Impellas and balloon pumps, that stuff is all very intimidating, but there is so much to learn in this field. And I wish I had known how much I was going to love the critical care side of the job that I get to do every day. So my words of advice for somebody that wants to become a flight paramedic is, you need to become a very good regular paramedic and really master kind of that job for years and become very comfortable before you even really want to jump into the flight paramedic side of things. This is a job that is combining 911 calls out in the middle of nowhere with just your partner, and you're going to have this critical patient for hours in the back of a helicopter that may or may not be very dark. And so if you're someone that just doesn't have that experience, I would say become really comfortable with becoming a paramedic and keep studying for years before you decide to make that jump to flight paramedic. And then on top of that, I would say find somebody that is doing this job. If you want to work for a particular agency, find out if you know somebody that works there and just talk to them about the job. It can go a really long way to help you prepare to work for that specific agency, and it can help you decide if that agency is where you want to work, or if you want to take your time somewhere else and put your time into a different agency. So I would say my words of advice are: 1, keep studying and stay very humble. And then 2, find someone that does that job and really research before you try to apply to a particular flight program. So I have a lot of favorite things about my job. I think probably that the people that I work with are pretty incredible. One of my first shifts at my agency was with somebody that was a flight nurse for longer than I've been alive. So it's pretty awesome to walk into our base sometimes and see the people that I get to work with every day. And it makes you feel really inadequate at first, is that these people have been doing this job for so long and they are so good and so happy to be doing this job. It is really kind of a humbling experience. So this is where I want to be. I've worked kind of my whole career to get to where I'm at now. So this is absolutely not a stepping stone for me. I'm at the agency that I want to retire from. I'm very happy with where I'm at, and I have no intentions of doing anything different. If I did anything on top of what I'm doing now, it'd be just integrating more education and things like that into my job. But I am very happy with where I'm at right now, and I could definitely do this job for the rest of my career. It's kind of a lifelong career for me. So one thing that I would add is that if you want to become a flight paramedic and you realize that is the career that you want to do, try to get as much information about that field as you can. So different flight programs, they run different types of calls, and depending on the area they work is a very different environment. You know, say a flight program in Nevada or California is going to be a lot different than one in Washington or Idaho. And so really do your due diligence, research the programs that you want to work for, and then find somebody that works for one of those programs and, you know, ask for a ride along or ask for some advice on what the interview process is like or the hiring process is like. And then once you've kind of decided that you want to do this job, really put in the time to learn and ask a lot of questions. Ask your partners from day one as an EMT or a paramedic. Try to learn from everybody that you can and really create that really humble learning mentality kind of reputation, because the flight world and EMS in general, it's a very small community. And so if you have that good reputation of being somebody that wants to learn, is a hard worker, that's going to go a long way when you go to apply for a flight agency, especially when it comes to getting things like letters of recommendations, or if you're reaching out to somebody that works for a flight program. If you have that reputation already, they're going to be a lot more willing to help you and go that extra mile to get you hired at the agency that they work for, because in all reality, we want to work with the best people. You know, we want to work with the best paramedics and the best nurses. And so we want those types of people in our agency, and we want to keep the people that are not going to put in the time or the effort, or they just think they know everything already. We don't want those people to be working with us. And so be humble, be a sponge, and just put in that effort early and put in that effort often.